So I'd like to pass it over to Wendy Gladman, Director of Community Services at Loddon Shire, to talk about the Loddon Healthy Minds Network.
Thanks, Rick. And our presentation today is around the model of the Loddon Healthy Minds Network and working together for our community. So an inclusive, resilient and stigma-free Loddon community with access to appropriate mental health services. If I were to remove just one word, Loddon, I'm sure that this is now something that you would agree in some way, no matter what our role or where we come from, we would like to see. So as Rick mentioned, my name is Wendy Gladman and I'm the Director of Community Wellbeing at the Loddon Shire. And Rick and I are here to present the Healthy Minds Network model. Rick is one of our Healthy Minds Network community representatives and a founding member. And we're very proud to talk about the Loddon Healthy Minds Network. The network is a group of community members and service agencies and council working together to achieve the best outcome for our communities. I'll tell you a little bit about the Loddon community and the challenges we face, how the network started, what we've achieved so far, and then touch on what we're going to do next as we work towards our vision of an inclusive, resilient and stigma-free Loddon community with access to appropriate mental health services. Rural communities are great places to live, but the challenges that they face are high. Rural communities are strong and resilient, but how much they can continue to deal with as they struggle to thrive or even survive. How do our communities continue to evolve to deal with the changes happening in and around them? Our network aims to provide resources that are designed for rural communities and to continually work on ways to engage the community to raise awareness of mental health, to ultimately reduce stigma and to ensure that available information is readily accessible. As a network, we aren't a provider of mental health services, although some of the individual agencies do this in their substantive roles. We aim to work with our communities, to support them to support themselves, to ensure that people have the skills they need to do this, to see that they can access the information they need, and to know that as a community they can look out for each other. So firstly, a little bit about the Loddon Shire. Loddon Shire is a small rural council in north central Victoria. We cover an area of approximately 6,500 square kilometres with a population of 7,500. The number 42 is to put this into context for you. If we placed our population per square kilometre into the Melbourne City Council area, there would be just 42 people living there. The Loddon municipality is a community of communities comprising a number of towns dispersed throughout the Shire, including our three largest towns of approximately 800 people, followed by a couple of towns with 400 to 500 people, and then a scattering of localities with small population bases, anywhere from 10 to 100. We have no one major regional centre, and we have long distances between our larger towns. The Shire is primarily an agricultural area, with 40% of our population employed in that sector. We know that any downturn in agriculture has a wider impact on the community, our small businesses, our education facilities and the local sporting clubs. In the last 25 years, we've experienced below average rainfall or drought for about half of that time. This has been interspersed with 5 major floods, including a 1 in 200 year event in 2011 that saw floodwater cover a large portion of the municipality, and of course the challenges and impacts we are facing as we deal with the COVID-19 pandemic. Now we know the range of factors influence our health and wellbeing, and it's important that we take into account all of these factors when we think about how we might influence or promote better mental health and wellbeing. Other influencing factors include changes to the systems that shape the conditions of daily life, for example, economic and social policy or social norms. Our 2017-20 to 21 Public Health and Wellbeing Plan data identified some of the factors influencing the health and wellbeing of our residents at that time. We know that Loddon had an ageing and diminishing population with higher levels of relative socio-economic disadvantage. We acknowledge that disadvantage is not unique to rural communities, and it also occurs in regional and metro areas. A lack of appropriate housing, low education attainment, job insecurity or unemployment. But when we add to this the poor connectivity that we still experience in many of our communities, both mobile and broadband, the lack of suitable public transport, meaning that people are unable to easily travel to and from tertiary education or work or health appointments outside of their own community without relying on private transport, and the environmental challenges that have a pervasive impact on our rural communities, the disadvantage we experience is compounded. We had higher rates of chronic disease risk factors, a higher proportion of the population with 2 or more chronic diseases, and higher rates of deaths and hospitalisations from injuries unintentional and unintentional. We have a higher proportion of our population who do not eat the required amount of fruit and veggies, didn't get enough physical activity each day, and didn't drink enough water. Education attainment in Loddon was generally lower, and our young people entered school developmentally vulnerable, and our data told us that in primary school they were more likely to be absent from school than normal. Our young people also reported high rates of bullying, and we had a proportionally high rates of children in out-of-home care or kinship care. Our average weekly household income was significantly lower, but we also know that housing for our residents was more secure. They were more likely to own their own home outright and were less likely to pay rent. They paid on average less than half the Australian median for their mortgage repayments or their rent. Residents were less likely to be unemployed, but we also knew that our average age is related to the loss of 19 to 45-year-olds from our community who seek education and or work away from the municipality. We had small pockets of cultural diversity, but the population was mostly Australian-born from Australian-born parents. We're good volunteers and with high rates of volunteerism, and the majority of our community reported feeling safe and supported and believed that people were willing to help each other out. Now, if you live and or work in rural communities, I'm sure that many of these will be familiar themes. And when we look at that profile of the community, it's easy to wonder where to start. And in this situation, some 13 years ago, we are pleased that a local community group decided that it was important to just start. So in 2007, a community mental health support group in Wedderburn was concerned about the lack of appropriate mental health services and supports available locally and the high levels of stigma associated with mental health and mental health illnesses being experienced in the community. With some seed funding from our local primary care partnership and later that same year an endorsement by Loddon Shire, the Loddon Healthy Minds Network was formed. The development of the network was based on the Healthy Minds model operating in Swan Hill at the time. So what does a Healthy Minds network do? We promote and advocate for improved wellbeing and access to appropriate services for people affected by mental health illness, and promote optimal mental health and reduce stigma through awareness, advocacy and education. The Loddon Healthy Minds network really did start small and was literally developed from the ground up. The goodwill and good intentions of a small group of community members led to the establishment of the Loddon Healthy Minds network. The original group consisted of just 3 representatives from 3 local agencies and 4 community members. The Loddon Shire continues to auspice the network and provides some operational funds, the support of a senior staff member and administration staff to facilitate the network, and we have a councillor representative as our chair. When we think back to when this network started, we have to consider the environment that they operated in. There was very basic website activity, little social media. Was Facebook even a thing then? Much of the information about available services was paper-based, but changing so often that it usually meant that printed documents became obsolete really quickly. There was a lack of understanding in the community about mental health illnesses, or how to access information when needed. And it would be fair to say that the stigma surrounding mental health prevented people from talking about mental health, from seeking treatment, and compounded the challenges already faced when dealing with a mental health illness. The initial work was to establish the network, the development of the governance structure, the branding using the Healthy Minds logo. The Loddon Healthy Minds network website was created and provided a range of information relating to the network activities, but also had information on the services and supports that are available. And this was the first time in Loddon that we could access all this information in the one location and electronically. We gradually increased the membership from 3 agencies and 4 community representatives to now include representatives from most of the health, community health and mental health service agencies in or delivering into the Loddon community. And the most important, increasing our community representatives from 4 to 7 has improved the spread of reps across the municipality. So I'd like to introduce a network founding member and a community representative, Rick Rafters, to share the valuable commitment that community representatives make to the Loddon Healthy Minds Network. Handing over to you, Rick.
Thank you very much, Wendy. Well, this has been a fantastic journey from day one when the network was first established. And the vision initially was that we would have community support groups in each of the major towns where people with mental health issues or people with an interest in mental health or people who were carers of people with mental health issues could go along to, so that it would be relatively anonymous about why you were there, but it would at least have a support group that could discuss issues, because there were a lot of stories coming out from different people about the experiences that they had had in mental health facilities, which weren't particularly good, and some of them had a great deal of difficulty in articulating those experiences and also in advocating for themselves. So the concept was to have those community support groups feed on up the line to the Loddon Healthy Minds Network, and being a local government organisation and committee would have direct access to state government ministers and politicians and things of that nature who were responsible ultimately for mental health care in the state. Personally, I have bipolar disorder, and I've dealt with that for well over 20 years now. And I've found that there are a lot of people who struggle to actually go out and come out, as we've talked about earlier today, with the mental illnesses. And Joe has talked about the issues with stigma, and they are very real. So community representatives are very important in this type of structure, because they're the people who can mix in the community. The community people will actually talk to them, and they can bring the real issues back to the network, where there are various professional members who might be able to provide solutions to particular problems that are being faced in various communities. The tyranny of distance is probably the biggest one, and access to services. And it's been interesting that as a result of COVID, one of the best things that has come out of it, from my point of view, is that for many, many years, at least 10, I'd say, Wendy, we've been trying to get access to video conferencing through psychiatry and psychological services, and met enormous amounts of resistance. And all of a sudden, the barriers have come down. So people don't have to travel long distances. They don't have to wait in doctors' waiting rooms. They're not incurring the cost of travel, etc., etc. So that's been a very positive outcome, and people can talk much more freely about the issues. So we would love to hear more about any of your stories, about how ideas or concepts that might be working in your communities to support those, and how we might be able to, as a Loddon Healthy Minds Network, to implement your ideas in our communities to make them better. After all, what we're after here is really trying to make sure that we raise the issue of mental health awareness, and we certainly get some talking done around suicide prevention and improve the mental well-being of our community members. So over to you, Wendy.
Thanks, Rick. So some of the things as a network that we've done and been working on is to find ideas that we could Loddonise, that we could adapt to being delivered in small rural communities. And where it was needed, the network also developed some of its own resources. So we started simply with our fridge magnet. And to date, we've distributed over 15,000 of these magnets. We get them out through mail outs, we have them in our health services, our community houses, we distribute them at local events and activities, and that the network's involved in, and usually annually at the Elmore Field Days. This poster was also developed by the network in conjunction with our local P12 colleges and young people to provide information for our LGBTIQ youth. We have a video available online on our Healthy Minds Network website for carers, and it involves carers of people with a mental health illness talking about their experience. We support, promote and advocate for the funding and delivery of mental health first aid courses and have been delighted with the number of mental health first aid courses on offer over the years. We introduce opportunities to talk about mental health. We hold sunshine breakfasts and conduct an annual art competition, which has now expanded to include sections for students from prep to year 12 and an open section. When we can, we go to field days and local events, agricultural shows and local community festivals. We display the artwork from the competition, we hand out our show bags and we start conversations. Our members visit other clubs and groups as guest speakers, and we use our local media, our website and social media platforms to promote our activities and raise awareness in our community. So these are two of the entries in our 2019 art competition. Our themes were Mental Health Matters to Us All and Mental Health Begins With Me. And you will have seen also some of the entries for our 2020 competition that have been showing through our breaks. In August 2018, the network hosted its first Suicide Prevention Forum. The network focused on presenting activities that could be easily be adapted or delivered in rural communities, which is reflected in our forum theme, Suicide Prevention, it's everyone's business, rural strategies that work. And with an overwhelmingly positive response about the value of the first forum and feedback about the practical solutions that participants were putting into place in their local communities, groups and workplaces, it reinforced our resolve to make this a biannual event, which brings us to SPF 20, although being delivered to you in a different way this year to what we imagined we would be doing. As I mentioned just before, we've taken every opportunity to talk about mental health with our schools, our boards, our community groups, our staff members, anyone who would listen. We want conversations about mental health to become the same as conversations about any other health issue. We advocate on behalf of our community about issues impacting our community's mental health, about changes to local mental health services that adversely impact members of our community, and about barriers being experienced by our community that are preventing access to appropriate mental health services. Our strategic plan guides our direction to reduce stigma, to increase community understanding of mental health and mental illness, to provide education and support to assist them as the first tier of support, and to make sure that there is relevant and current information and contacts available. And whilst this is all valuable work, we still had other factors influencing the mental health outcomes of our community, which led to the network linking in with the public health and wellbeing planning undertaken by Council. The health and wellbeing plan identifies the factors, whether social, health or behavioural, impacting on the health and wellbeing of the community, and what we want to achieve to improve these outcomes. And it's important to note, though, that many of the people undertaking this work acknowledge that the changes implemented now may not show in the data and the statistics until many of us are no longer working. This meant that mental health intersected with the other pillars within the plan of physical activity and healthy eating, children and families, and family violence. The community has continued to indicate that promotion and raising awareness of mental health issues and suicide prevention are still important areas for the network to continue to focus on. Organising and delivery of the 2020 Suicide Prevention Forum has been a main focus for this year. And with our smoothie bikes arrival, we will soon have these out in our community for use by our local agencies and groups. A great way to promote healthy options, exercise and healthy food choices as contributors to good mental health, and a great way to start those conversations. We want to establish ways to measure the impact we're having as a network. We want to continue our work to reduce stigma. We will talk and talk and talk. We will continue to talk until we normalise mental health conversations in the community. We'll promote and advocate the use of positive mental health messaging by our media, and we want to continue to promote and advocate for the delivery of mental health first aid training courses in our community, particularly to those groups who are high influencers. We'll continue to participate in the public health and wellbeing framework, ensuring that mental health intersects with all the other identified pillars as we develop our new plan in the coming year. We'll continue to advocate for appropriate mental health services for our community, which enables a person to seek the mental health service or support they need when they need it. And this also involves supporting the community to evolve and accept new ways of accessing services, for example, telehealth, which links nicely to the advocacy that we're also doing to improve connectivity across our municipality. We want to continue to promote and demonstrate the Healthy Minds Network as a model that can be expanded, supporting other communities in establishing similar networks. So some things to take away. Starting small is okay, and even if what you can start with is only small, just get started. You never know where it might lead. Find opportunities to work together towards the same outcomes. Working together is paramount to maximising health and wellbeing outcomes. Find opportunities to intersect with other already established platforms that have associated outcomes that influence or impact on mental health and wellbeing. And never stop talking about mental health. The best way to break down the stigma associated with mental health in rural communities is just to keep talking about it. If you have any questions about the Loddon Healthy Minds Network, my contact details are listed here, and we would love to hear from you. Thank you.